Thank you for coming to www.insurance-network.com. My name is John K. Arnold, and I've been doing insurance since 1982. I'll be your guide here for the Inbound USA program, medical coverage for non-U.S. citizens visiting the U.S. This plan is the most popular plan for visitors that are relatives coming over, particularly from India, visiting, say, a mother, a father, brother, sisters, family, and so forth, coming here for a visit to the U.S. Why you need this program? You probably already know why. The United States offers the most comprehensive medical care, but it is often complicated as well as very expensive. For a visitor to the United States or a recent immigrant, finding an insurance program that is easy to understand and reasonably priced is often difficult. As a solution, Inbound USA was developed to provide a simple program to visitors and immigrants. This is a brief description of the Inbound USA program. Detailed wording is outlined in the program summary, which will be mailed to you once you have enrolled in Inbound USA. Eligibility. This program is available to non-United States citizens who come to the U.S. for business, pleasure, to study, or to immigrate. The program must become effective within 12 months of arrival in the U.S. Typically what's done with this program is it's for a visitor that may become 1 to 6 months, 8 months to the U.S. They could come back the next year and have it again, and the next year and have it again. It is something that we typically find people use from year after year, trip after trip. The period of coverage. You may enroll initially in Inbound USA for as little as 5 days and up to a maximum of 12 months. If you initially purchase at least 3 months, you may continue to renew coverage for a minimum of 3 months at a time. We use the online enrollment system. You get quotes and enroll right online. With that system, you're able to buy by the month and renew. You do it by email, you do it electronically. Typically people do it for longer periods of time, but you can do it however you want. If you have any questions or issues, you can give me a call or you can send me an email at John, John, at insurance-network.com, and I'll be happy to help you. Schedule of benefits. What this is a scheduled benefit program, and I'll be showing you how that works on the chart. Some key things to remember about this program is this is a plan that has benefits per injury, per illness. It has a set of benefits and a deductible for each injury and each illness, as we'll detail below. It does exclude pre-existing conditions. We'll go into that a bit below, but typically the look-back time for pre-existing conditions for under the age of 70 is 6 months, and the look-back time for pre-existing conditions for age over 70 is 12 months. We'll discuss pre-existing conditions a bit more down the way. You do have the option here of having some coverage for the onset of a myocardial infarction or stroke during the period of coverage, if it is determined to be a pre-existing condition. What you'll see here are the benefit choices for people between the ages of 14 and age 69. You have a set of plans. These plans have different maximums. Plan A has $50,000 maximum, and that's per injury or sickness. Plan B is $75,000 max per injury or sickness, and Plan C has $100,000 max per injury or sickness. Plan D is $130,000 maximum per injury or sickness. Now, what's important here to understand too is not only is it the maximum, but it raises each of the scheduled benefits that you have. So in this example, inpatient hospital, this plan has a maximum of $1,400 per day. As you look, as the maximum goes up, so does the amount of the for hospital room, up to a maximum of $2,535 a day. Now, what you have, and it's back up here, is a choices of deductibles, and you'll be able to see this easily on the quote system. The deductibles can be $0, $50, $100, and $100 and $200 are available for ages 70 and over. The plan covers inpatient and outpatient services. So what you find is you will have hospital benefits here, for instance, surgical treatment. Plan A is up to $3,300. Up to Plan D is $7,150. Outpatient services include surgical treatment, anesthetics, assistant surgeon, physician non-surgical urgent care visits, and diagnostic x-rays, lab services, emergency room, prescription drugs, and outpatient surgery. This is a scheduled benefit program. That means what you see here are particular services. One of them that you might look at is physicians non-surgical urgent care visits. This tells you what the amount payable is. It will pay up to $55 a visit per day, 10 visits max, for that particular injury or illness. As you go up the scale, you find that the maximum increases. The plan over here pays $110 per visit, up to 10 visits maximum. So as you increase the maximum benefit, you also increase the maximum for each service. Now, once again, that is per injury or per illness. So if you have a separate thing, for example, let's say someone has an injury and hurts their knee, that would have its own set of benefits. If separate from that, they have a sickness, that sickness has its own set of benefits. And what this covers is the benefits all around that particular circumstance. Other services are covered as well: ambulance, orthopedic prosthetics, chemotherapy or radiation, dental treatment for injury, mental and nervous disorders, and so on. Now below this you see the chart. This is for people ages 70 to 99. With this you have two choices. It has a $50,000 max per injury or illness, and this one has a $70,000 max per injury or illness. You'll have choices of deductibles, either $100 or $200, and when you use the online quote system at www.insurance-network.com, you'll be able to easily and quickly make those choices, get your quotes, and do the online enrollment. One of the things I wanted to have a look at is the definition of a pre-existing condition. Pre-existing conditions will mean a condition that would have caused a person to seek medical advice, diagnosis, care, or treatment within the 6 months or 12 months for a person 70 and over prior to the individual effective date. So under the age of 70, the look-back period is 6 months. Over the age of 70, the look-back period is 12 months. Now, what that means is if the pre-existing, if they're taking medications for any of those things, and as defined here, that would have caused a person to seek medical advice, diagnosis, care, or treatment within the 6 months or 12 months prior to the plan effective date, as defined in the policy. Another thing that was important to understand is the exclusion for routine physicals, inoculations, or other examinations where there are no objective indications of impairment of normal health, and well baby care, newborn baby care, well baby nursery, and related physician charges. We often get the question, can you come to the U.S. and have physicals and have other regular medical care? There is no policy out there that provides that kind of care. These are insurance policies, and they're meant to protect you against unforeseen illnesses or injuries and make sure that the person can obtain medical services and have an insurance card to hand over to the providers when that happens. So these are to prevent insurance. Often it is a good idea to have the medical care as extensively done in the home country prior to coming over, just to be assured that everything is taken care of. And then get over here and have your insurance in the event of some unforeseen accident or illness. You'll see the rates here. However, what you'll find is it's much, much simpler to use the online system on the website. That way you can get immediate quotes, you can figure it out for the exact time period you want, you can put in the information, and when you're done, you'll immediately have the ID card for the person with their name and everything on it. Once again, my name is John K. Arnold, and this is for www.insurance-network.com, my website. Please let me know how I can help you.